I'm Kristen Goodwin. On this episode of the Fox News Rundown, pharmaceutical companies Moderna and Pfizer telling lawmakers they've solved production and distribution challenges, planning to significantly boost COVID-19 vaccine shipments to the U.S. government over the next few weeks. As the nation catches up on inoculations, there are growing concerns about coronavirus variants. Professor of Surgery and Health Policy at the Johns Hopkins University School of Medicine and Fox News medical contributor Dr. Marty Makary discusses the new strains and whether vaccines will be effective against them. And Congress is working to finalize President Biden's $1.9 trillion coronavirus relief package. Former President Obama economic advisor and Fox News contributor Robert Wolf shares his insight on the latest aid bill and the possibility of a $15 an hour minimum wage. Plus commentary by Fox News legal analyst Greg Jarrett. The Fox News Rundown is a daily news podcast where we take a deeper look at the stories important to you. You can subscribe on your favorite podcast player by going to foxnewspodcast.com.
I'm Brett Baer.
I'm Maria Bartiromo.
I'm Brian Kilmeade, and this is the Fox News Rundown.
Wednesday, February 24th, 2021. I'm Jessica Rosenthal. Just when we thought we might be out of the woods with a vaccine, we're told to beware the new virus variants.
Right now, there is an unknown, but we think so far we're winning and we can manage in the fall.
I'm Dave Anthony. It's a plan to give more relief to Americans in this crisis, but some on the right and left worry there's too much money in it not related to COVID.
I'm for no pork in this bill. I'm for it straight for pandemic relief. It's not a stimulus package. It's not a budget package. Okay, this is a pandemic relief package.
And I'm Greg Jarrett. I've got the final word on the Fox News Rundown.
The heads of pharmaceutical companies are promising more doses of vaccine in short order as state officials complain of short supply.
Distribution issues need to be fixed. Earlier this month, we heard from 5 states who made clear supply limitations are the number one barrier to getting more shots in people's arms.
That's Washington State Republican Congresswoman Kathy McMorris Rodgers. Officials with Pfizer and Moderna promised her and other members of Congress more vaccine doses are on the way. Moderna President Stephen Hoge said by the end of March, they will have delivered 100 million doses.
We are now targeting delivery of the second 100 million doses of our vaccine by the end of May and a third 100 million doses by the end of July. A full 2 months ahead of schedule.
Pfizer's group president promised another 80 million doses by the end of May after delivering 120 million doses by the end of next month. Johnson & Johnson's new single-dose vaccine could be approved by early next week. But will they work in the long term? The data initially showed they were pretty effective, but these vaccines were created before we started hearing about these new strains or variants of COVID. Pfizer Group President John Young was first to address the concerns Tuesday.
With 95% protection against the original strain, we've now performed in vitro studies on immune responses elicited by the vaccine against new variants, such as those from the UK and South Africa. Based on these data, we believe the vaccine should provide protection from these variants. Real-world evidence from the UK and Israel appears to confirm this for the UK strain, and to date, we've seen no real-world evidence that suggests a significant reduction in protection provided by our current vaccine.
So if we get a vaccine, are we good to go? Can we go back to normal, or should we be skeptical as the virus changes?
The rate of mutation is concerning, but the current mutations, the current variants that are out there still seem to be covered by the vaccines.
Dr. Marty Makary is a professor of health policy and management at Johns Hopkins School of Public Health and a Fox News contributor.
More studies are coming out, and while they may not be as effective in preventing you from getting infected with those variants, they appear to be almost 100% effective in preventing death from those infections. That's really the outcome here. We talk about efficacy. We should really be talking about how often it prevents dying from the infection. And so far, with all those vaccines, it's almost 100%.
And serious illness as well, right? I mean, we also don't want serious illness or long haul symptoms, right? I mean, what do we know about the vaccine's efficacy there?
We haven't studied the long haul symptoms after people who got infected who were vaccinated. But we can use a lot of scientific deductive reasoning to say, look, if they're this effective in reducing the severity of infection, then naturally you're going to have a lower viral burden and be less transmissible. It's funny. Sometimes I hear Dr. Fauci say, 2 masks or 3 it's common sense. Well, we can use common sense also in asking the question about transmissibility. If the vaccines reduce your viral burden, if they massively reduce the chance of getting the infection and they reduce the severity of infection, common sense tells you you're far less transmissible.
Let's talk about the variants, though, that we keep hearing about in the UK and South Africa mainly. Those are the countries I keep hearing. And forgive me if I'm not saying this properly, but B.1.1.7 is one of them, and B.1.351. Do you guys just say B117 and B1351? How do we say those?
That's right. That's how we refer to them, or sometimes we call it the UK strain and the South African strain. And if you look at what's happening in those countries, we have had this in the US, massive 77% decline in daily cases over 6 weeks. But England also has had a massive decline, 82%, with that B117 variant being the common infection strain. South Africa has had a 90% reduction in daily cases. So even where we've seen the UK and South African variants dominant, we're still seeing massive reductions in cases, and it may be driven by natural immunity and some vaccinated immunity. The Brazilian variant, though, Jessica, the P1 variant, that's one I'm a little more concerned about watching carefully. The Brazilian infection hasn't really declined quickly. It's been a little more persistent, and it may be from that strain. That strain is rare in the United States. It's been documented twice, but that's something to keep an eye on. The bottom line is we're beating the new variants. We're beating all forms of coronavirus in the United States this spring. We have to keep an eye on the variant that may become epidemic in the fall. And people ask me all the time, what's the fall going to look like with COVID? It may look like a bad flu season. Hopefully that vaccine will be adjusted accordingly. Actually, hopefully the current vaccines cover it very well, and we may not need an adjustment in the vaccine.
That was actually my next question. How effective are these vaccines against new strains? I mean, we've heard Dr. Fauci say that we might have a stumbling block coming up with the appearance of variants. A stumbling block doesn't mean, end of the road, turn around and go back, though. And we've also heard from folks in the pharmaceutical industry that, they're expressing some confidence that their vaccines will work. I don't know if we even know yet, right? I mean, the vaccine rollout is still relatively new.
Well, you're right in that our studies of the effectiveness of the vaccine lag behind. And when you have new strains, to have enough people where you can actually make a conclusion and say it's X% effective, those studies take time. It's like when cigarettes came out, the companies told us that they're good for your health. And finally, after 2 decades, public health research caught up. And that's what we're doing. We're playing catch up. But right now, we are not seeing outbreaks among vaccinated individuals anywhere in the world. That's good news.
That is. But I feel like with these variants and warnings of, while we're not totally out of the woods, that people are getting frustrated. Like we still don't seem to have the answers we thought we would have more than a year into this.
That's right. And I liken it to a patient that I have in the hospital who says, Doc, when can I go home? And we say, probably on day 5. And then day 5 comes and they're not quite ready. And they're so angry, right? The expectation's been there. Like I've deceived them. And then they say, okay, well, if not to day 5, definitely the next day, definitely. And it's like, you can't negotiate with, biology. You can't, these, medical illness, sickness, disease, viruses, they have their own, they don't care. They're not at the negotiating table. So I understand why people are frustrated, but it'll be with us in the fall. Hopefully it'll be manageable. I think it's good to have a balanced perspective about what's known and unknown. And right now there is an unknown, but we think so far we're winning and we can manage in the fall. And we've got the switch ready to turn on if we need to ask people to wear masks in the fall.
I want you to listen to this. It's Pfizer's group president, John Young, explaining to members of a congressional committee Tuesday. Well, I don't even know exactly what he's explaining, but he's explaining how the vaccine sort of works against differing variants. Take a listen.
We are laser focused on the potential impact emerging variants of the SARS-CoV-2 virus could have on the ability of our vaccine to protect against COVID-19. Our mRNA vaccine affords the opportunity to provide boosting doses if needed, and the ability to rapidly alter the mRNA sequence in the vaccine to address potential changes in the virus if evidence suggests that they might reduce protection from the current vaccine.
He's using words rapidly alter the sequence. Can you talk about what that means, and would that be possible to do by the fall if things took a turn?
Yeah, if you go to these centers where they design the vaccines, you might expect, all of these test tubes and, Bunsen burners. But instead, what it is a bunch of supercomputers. And these are mathematical designs. You can actually create the DNA sequence that translates in a computer to a molecule. That is how that mRNA will convert into a protein once it's injected. And you design an mRNA vaccine. And so that's what's happening right now. They're taking the new variants. And by the way, it's not just one mutation that causes the UK mutation or the South African. It's multiple. There have been dozens of mutations since the pandemic started. And so it's pretty interesting how they design it. And so they're working on that right now. And the FDA just came out with some new policies that said we're not going to require phase 3 trials that take 4 months and then, wait for a month for FDA authorization. They're going to streamline a process so you can take an already authorized vaccine and adjust it, and they're going to be able to streamline that. That's what we really need to prepare for the fall if the current vaccines are not going to cover the strain that's going to be common in the fall. With flu, we watch to see what happens in the southern hemisphere when it's winter there and summer here. When we figure out which variant of the influenza strain is most likely to jump in and be dominant, which is the most transmissible, then we pick a variant and we design a vaccine for that variant. And that's kind of what we're starting to do here.
Finally, doctor, I have a relative who got the vaccine. He's just about 80. His cardiologist told him, even though you've been vaccinated, do not change a thing. Keep staying away from people, socially distance, wear a mask. When will the advice be, okay, you've been vaccinated, you can, go to a restaurant, you can go to your daughter's house for dinner?
Well, we have physician discretion to customize recommendations based on our own practice styles as physicians. So you're going to hear different things out there. But I would tell folks that if you're in that situation, live your life. Give it a good 3 to 4 weeks after your first dose, and ideally 2 more weeks after your second. But get out there and live your life. Loneliness is one of the great public health epidemics that predated COVID, and it's been magnified during COVID, and it's rampant among seniors, and it causes suicide in some folks. And we've got to start rebuilding communities. Loneliness affects your physiologic reserves. I've seen patients sick, scared, angry, and when they're in the hospital, you touch them, and that has a powerful effect. And we've got to start hugging and touching and getting back together, because we've got to be practical, right? Officially, I'm supposed to tell you wear your mask for as long as this thing is around, but practically, we've got to get out there, and your relative needs to get out there and hug the kids and be with other folks right now.
Dr. Marty Makary, thank you so much for your time.
Great to be with you, as always.
This is Greg Jarrett with your Fox News commentary coming up.
We're nearly a year into this coronavirus pandemic, and the trends are in the right direction.
In recent weeks, the number of new cases and hospitalizations has been falling, and ongoing vaccinations offer hope for a return to more normal conditions. later this year.
But Federal Reserve Chairman Jay Powell also told his Senate hearing on Tuesday,
the economic recovery remains uneven and far from complete, and the path ahead is highly uncertain.
Congress keeps working on another financial aid package, including another $1,400 for most Americans, which Treasury Secretary Janet Yellen says will help
to make sure that pockets of misery that we know exist out there that aren't touched by the more targeted things that help is provided.
Many businesses also still need more assistance.
You can't have economic health without public health.
Robert Wolf was an economic advisor to President Obama, now a Fox News contributor and founder of 32 Advisors.
Literally the catastrophe that this pandemic has put upon Americans over the last year has been something like we have never seen. And so, yeah, I think we are far from out of the woods with respect to the economy. To get those small businesses, the 1 in 5, 1 in 6 small businesses closed, figuring out how to get them up and running, the 10 plus million people who are still unemployed from the pandemic, to figure out how we can get them back into the jobs market. So, yeah, there's light at the end of the tunnel, but it's not around the corner.
Some of those businesses are done. They will not be able to reopen. Of course, there were it depends on where you live, but there were more restrictions in some places than others, and companies and restaurants had to close in some places more than others. So it's not going to be even everywhere, right?
Absolutely. I think to your point, there were different scenarios with reopenings. Certainly, the cities that had a higher population, that was a little tougher at inception for social distancing, had more restrictions. The places with travel and tourism, places like Hawaii, places like Las Vegas, they obviously were impacted in a much more harsher fashion due to the lack of commercial flights and the lack of being able to go into those large types of hotels and casino environments. So, yeah, it's not going to be even. There are going to be those businesses that don't open. There are going to be those businesses that, due to the facilities of lending, will certainly try to open. But it's hard out there. And by no means do I think we're in a good stage today.
Starting on Wednesday, there is a change for a couple of weeks in the PPP, that business lending program for Congress. Is like $150 billion of money still available. And they're going to target that to companies with fewer than 20 employees. Do you think that's a good idea?
I think that the PPP program was really smart. I think the execution was flawed. So, for example, I don't think a public company should have been allowed to get PPP. They can go get a bank loan, may have been expensive. They can go to the public markets. They can issue more stock. There are ways for them to get funding. Whereas a small business company, small business owner, that literally may have to close because of something that had nothing to do with him, like the pandemic, they're in an emergency situation, and they should be looked upon in a different way.
There is more aid for small businesses in the new package President Biden is pushing.
We need Congress to pass my American Rescue Plan. It deals with the immediate crisis facing our small businesses. Now, critics say the plan is too big. But let me ask them a rhetorical question. What would you have me cut?
Well, it's not rhetorical to Republicans. They'd cut out a lot.
This is supposed to be a COVID bill. Only 9% of it goes to COVID.
So House Minority Leader Kevin McCarthy tells Fox,
it's what the Democrats always want to do, spend more money from a hardworking taxpayer.
Now, all Republicans voted no when the bill was approved by the House Budget Committee Monday. They say it includes bailouts for some and legislative pork for others, which we will get into in a bit. But big picture, Robert Wolf says we need something.
I absolutely feel there needs to be another relief package. I'm not sure I would be at 1.9 trillion, Dave, but I certainly would be much higher than the 600 billion that the moderate GOPs came to the White House with, that group of 10. I thought that was a very lowballed approach.
All right, extra $400 a week for unemployment benefits, extending those as well. What is your thought on that?
Absolutely, for extending the uninsurance benefits, for extending the moratorium, for putting a halt on student loan payments. I mean, listen, this pandemic, was something we've never seen. You know, you and I have never seen, because the last time we saw something like this was in 1918. And so therefore, it was such a shock to the system. These people who have been impacted need extra help. And so I have no issue with extending unemployment benefits. I believe we have to make sure that our country is making sure people have food on the table. The food insecurity that has been caused by this, the poverty caused by this. I mean, people can't make ends meet, and that's not how America should be. And so I have no issue making sure that we extend the benefits.
All right. There's also something in here that Republicans have opposed for months and months, and that is aid to state and local governments. This $350 billion worth. A lot of Republicans say this is bailout money, especially for poorly run blue states.
Listen, I'm more of a moderate, but those are not the right facts. That's just not accurate. Yes, there were $350 billion that is for state and local communities. Something like $160 billion of it is going to police, fire, EMT, frontline workers. I mean, that $160 billion, McConnell and Trump actually supported it, before this plan. So the idea that the Republicans put zero for that amount is ludicrous. I think it doesn't even make sense. We know that there's a gap in police and fire and all the emergencies caused by the pandemic. Secondly, remember, a place like New York, they're a net contributor to the federal budget, whereas a place like Kentucky is a net taker to the federal budget. So the idea that this is a bailout, that's just ludicrous, because many of these states have been, literally givers to the federal budget. You can't look at the pandemic as a one-off, no different than you can't look at what's going on in Texas and FEMA as a one-off. Our federal government has to be there when certain states or the entire nation is in an unfortunate and unexpected situation. That's why we have sometimes this social fabric net that has to come through, whether it's a Medicaid or health insurance or other things. So I think the idea that this pandemic is a blue state versus red state is absolutely ridiculous.
We have also in this bill a lot of other money that Republicans have called pork. There is $50 million for family planning for nonprofits. There's $850 million for AmeriCorps, and then you go down and farther into this bill, money for the Institute of Museum and Library Services, $270 million for the National Endowment of the Arts and Humanities. So they're saying this is not COVID-related spending. Do you like that it's in there? Do you think this is just part of the sausage-making process? What is it?
I'm for no pork in this bill. I'm for it's straight for pandemic relief. It's not a stimulus package. It's not a budget package. This is a pandemic relief package. We need to give this relief now. And so there's a sense of urgency. But I think all these other tangential things that either side of the aisle want to put in, I'm not supportive of. But that being said, the $600 billion that the Republicans put up front, we know that number is way out of whack. So, for example, Dave, you look at the education part. The economists and the Biden administration said we need $170 billion to open all schools nationally. We know today less than 50% of the schools are going 5 days a week. Less than a third of high schools go 5 days a week. So therefore, we know there's a lot of money that needs to be put to work. The Republicans put up $20 billion. We know that number is just ridiculous for a group that's saying reopen schools. So
but some of the money that was earmarked,
right.
I'm sorry, Robert, some of the money that was earmarked earlier by Congress has not been even spent yet. And the CBO had determined that most of the money in the current proposal, $228 billion, will be distributed to schools 2022 through 2028, not this year.
Yeah, listen, the CBO does modeling, and I'm not going to say how accurate they have been or haven't been. Let's be honest, they were also saying that some of the Trump tax cuts would pay for itself as well, and we just had a $2 trillion deficit after the Trump tax cut. So listen, it's modeling. Modeling is not perfect. What I would say, I can't tell you the exact numbers it will take schools to reopen. I know it's more than 20 billion, and I know that should be one of the number one priorities. I haven't done the data and the modeling. I've listened to other economists. So yes, there could be a wide gap, but it shouldn't be that wide. I mean, this is not rocket science.
Another controversial provision in the bill, raising the federal minimum wage to $15 an hour. Many small business owners say they can't afford that. Cynthia Ariosta owns a pizzeria in California and told Fox and Friends First.
Absolutely. Are they worth $15 an hour? They are, but not if I can't pay my mortgage.
Now, some Republicans are pushing their own plan for a $10 minimum wage.
I mean, everyone needs to understand this is a $15 minimum wage that will happen over a multi-year period. It's not happening tomorrow. I have been a Democrat who has not been one of the staunch fighters of Fight for 15. I have been a staunch fighter for fighting for a living wage. So that could be 15, that could be higher in some areas, or that could be lower in other areas.
Are you sympathetic to small business owners for a big jump in how much they'd have to pay?
I mean, absolutely. I mean, our company, 32 Ventures, has invested in over 30 startups. That's what our company does for the most part, including in places in Flint, Michigan, where we have a couple business lines. There's no question that that could be detrimental to the small business, nor is there a question that $7.25 an hour doesn't cut it either. So we have to think more thoughtfully about it. I don't think it should be as such a blunt instrument, but I do think that $7.25 is the wrong number, and we need to increase it quickly.
Robert Wolf, Fox News contributor, former economic advisor for President Obama. Thank you very much for joining us.
Yep, thank you, Dave.
I'm Guy Benson. Join me weekdays at 3 p.m. Eastern as we break down the biggest stories of the day with some of the biggest newsmakers and guests. Listen live on the Fox News app or get the free podcast at GuyBensonShow.com.
Subscribe to this podcast at FoxNewsPodcasts.com.
It's time for your Fox News commentary.
Greg Jarrett.
What's on your mind?
News that the FBI and federal prosecutors are investigating New York Governor Andrew Cuomo's coronavirus task force in the deaths of thousands of nursing home patients, and a suspected cover-up of the truth invites the question, what crimes may have been committed? Well, let's begin with the obvious: obstruction of justice. If it's true that Cuomo's top aide, Melissa DeRosa, admitted to lawmakers that the state misrepresented the number of deaths in nursing homes to avoid having that data used against us, as she said, in a Department of Justice probe, then DeRosa appears to have confessed to a potential obstruction of justice charge. If others were involved, including Andrew Cuomo, that's conspiracy to obstruct. What about the crime of defrauding the government? In plain language, it means cheating the government. So if Cuomo or anyone in his administration provided false information to the New York legislature or to any agency of the federal government by deceitful and dishonest means, the government has been defrauded. And once again, if others were involved, that's conspiracy to defraud the government. What about the deaths themselves? Could Cuomo be criminally charged for causing more than 1,000 deaths when he issued an order in March of 2020 to send infected patients into nursing homes where elderly and infirm residents were most at risk of dying? Well, if Cuomo's name was Trump, you can bet there'd be a cacophony of calls for his criminal indictment for murder. Now, Cuomo would assert sovereign immunity to protect himself over any of his official acts, but it's worth considering. There's a provision in New York law whereby second-degree murder is defined as reckless conduct, creating a grave risk of death to another person and causing that death. Involuntary manslaughter has a similar reckless standard, but a lesser level of proof. So was Cuomo's decision so wanton, so reckless, that it was foreseeable that vulnerable nursing home residents exposed to COVID patients would die by the thousands? In retrospect, perhaps. Sovereign immunity would not protect Cuomo and his aides from criminal charges on obstruction of justice, fraud, and conspiracy. It's too early to know whether federal prosecutors will bring such charges. As the pandemic raged, Cuomo somehow found the time to pen a nauseatingly self-righteous book titled American Crisis: Leadership Lessons from the COVID-19 Pandemic. The sequel should be called American Failure: How My Arrogance Killed Thousands. I'm Greg Jarrett.
You've been listening to the Fox News Rundown. Stay up to date by subscribing to this podcast at foxnewspodcasts.com. And for up-to-the-minute news, go to foxnews.com. New from the Fox News Podcasts Network.
My name is Kennedy, and welcome to my podcast, which will, I humbly say, single-handedly save the world. You're welcome.
It's Kennedy Saves the World. Subscribe and listen now by going to foxnewspodcasts.com.
Love Fox News? Click the subscribe button to get more of the news and opinion you trust. And click the Fox News Rundown playlist for the latest episodes.